Okay, with all that said, prescription is really the bread and butter of plyometrics. How much do you expose them to? As a general rule of thumb, let's say you're working with a post-op ACL and they're hitting phase 3, so you're starting to introduce them to plyometrics. You might only want to do it 2-3 times a week. Now, if we look at the top end of what you want to do in like a sports performance setting, you only want to have about 100 foot contacts of forceful plyometrics in a week. So in the rehab setting, you want to build up to that. In your phase 5 ACL rehab, you should be at 100 foot contacts a week within your plyometric training. But you need to kind of bring that down at the beginning phase. What I usually tell the students I work with is 15 foot contacts a day is a good number to shoot for initially. And then after you spend a couple of weeks there, maybe 3-4 weeks, it seems like they're becoming competent in it, bump it up to 20 foot contacts, and then maybe 25 foot contacts or so. Plyometric training is also something that can be performed 2, 3, or 4 days a week. But again, you're gonna need to build up their capacity to that 4 days a week. So if you're working with that post-op ACL, by phase 5, every day of rehab should have plyometrics in it. But at initial exposure, maybe just twice a week, and maybe on like a Monday and a Thursday. And then if you see them on a Tuesday and a Friday for rehab, you don't perform plyometrics. Get them used to that 15 foot contacts, and then add a third day, and then add a fourth day. Once you've added a fourth day, then maybe start rising the daily foot contact limit up to 25. And then by the time they've hit phase 5, they're now at 100 foot contacts a week. If you only rehab your patients twice a week, you just see them twice a week, you can work up to maybe 40 foot contacts a day, twice a week. So you're getting to more like 80 foot contacts a week. But I probably wouldn't go above that. What I've seen with the students I work with and in my own patient care is if you try to get close to like 50 or maybe even 60 foot contacts, people just start complaining of shin stuff and Achilles stuff and knee stuff a couple of weeks down the road. As well as linear and lateral days are great to have if you can work plyometrics 3 to 4 days a week. So if you have 4 days of rehab with your post-op ACL, you might do a linear day, a lateral focus day, a linear day, a lateral focus day. 3 days a week, you might do a linear, a linear, and then the next week, a lateral, a linear, a lateral, and keep repeating. But if you only see your patients twice a week, it's probably best to pick a linear and a lateral drill, and every day is a linear lateral type of day. I usually don't use more than 2 plyometric drills for the day. Just muddies the water. Get the most juice you can squeeze out of 1 or 2 plyometrics instead of doing a bunch of plyometrics. Remember, whatever phase you're in, keep the goal the goal. So if it's initially in that sticking phase of plyometrics, then focus on just getting quality sticking mechanics down. They're absorbing through their knees and hips evenly, they're landing softly, they feel confident. Maybe you stress them at the precipice of their competency, so you're adding height to the depth drop or adding height to the box jump, adding distance between the hurdles before you actually progress to a harder form of plyometric drill. And then with that said, as you get used to the progression series, you can add in your own drills as long as they fit the criteria of that specific phase. So if you have a specific plyometric drill you like doing, just ask yourself, is this a phase 1 type drill, a phase 2 type drill, phase 3, 4 type drill? And then keep using it, but use it when it's appropriate. Don't use it in different times when the traits you're working on are different. With that said, we have a curriculum here at Montana Made for our therapy students that covers anything from movement assessment, movement taxonomy type stuff, aerobic fundamentals, plyometric fundamentals, corrective exercise fundamentals. If you're here for longer than 6 weeks, we have a bunch of elective lessons you can pick from that kind of cater to what you want to learn about. If you want to get more into manual therapy, or you want to get more into like breathing dynamics, rib cage dynamics, pelvic dynamics, orthopedic special testing, etc. Feel free to reach out. Really open to answering any of your questions or clarifying any of this for you as well.